When we treat patients, what are the strategies for implant surgery? We are using only treatment concepts which are strictly evidence-based, because the primary objective is a successful outcome with high predictability and a low risk for complications. And in routine, that's the third point, we only use biomaterials with a good scientific documentation. And this should be based on preclinical and clinical studies. And then the middle point is the so-called secondary objectives. And that's a very important topic today. You see, we want to make these treatment protocols more attractive to implant patients, and we made tremendous progress in the last 15 to 20 years by reducing the number of surgical procedures, reducing morbidity and pain for patients, and by reduction of healing periods and treatment time. And that will be the point to get today.